Okay, picture this. It's Tuesday morning, maybe 9 a.m. You woke up with that nagging pain in your shoulder again, or
Mm.
maybe it's that weird rash you've been trying to ignore for like 3 weeks.
Hmm.
You finally decide, okay, fine, I'm going to be a responsible adult, book an appointment.
The moment of truth.
You pick up the phone, you call the doctor's office, you are ready. You are taking charge of your health. And
The
then
hold music. The void.
the loop. You wait 10 minutes, maybe 20.
Hmm.
Maybe you get a voicemail box that's full. Or, and this is my personal favorite, you finally get through and you have to repeat your name, your date of birth, your insurance info to a scheduler, only to get transferred to a nurse line where, guess
You
what?
say it all over again.
Every single time. It's the universal healthcare experience. We roll our eyes, we complain, and we just move on. We assume, well, doctors are busy.
Right.
But today, we're looking at some research that suggests this isn't just, a minor annoyance. It is a systemic failure.
It really is. We're doing a deep dive today into a document from Cabot Technology Solutions, and it's called AI Medical Receptionist for Healthcare. And they're making a pretty bold claim right out of the gate.
Right.
They argue that the primary bottleneck in healthcare, the place where the system is really breaking, isn't in the exam room. It's not even the doctor shortage.
Okay.
It's the front desk.
It seems wild, right? I think most of us think of the patient experience as what happens when the doctor finally walks in the room.
But this source is saying, no, no, no. The experience starts way before that. It starts at the front door. And for millions of patients, that door is, well, it's basically locked, or at least jammed shut.
The text calls it the invisible crisis.
Exactly, because if you can't even get through that door, it doesn't matter how good the doctor is on the other side. You'll never see them.
Okay, so here's our mission for this deep dive. We're going to unpack why the traditional front desk model is, and I'm not using this phrase lightly, mathematically impossible to sustain. We're going to look at why those old solutions, those awful press 1 for appointments menus, why they actually hurt our brains. And then we'll get into the proposed fix, the AI medical receptionist.
And we should probably clarify right away, because I know what you're thinking.
Right.
We are not talking about a robot doctor.
No, this isn't Dr. ChatGPT trying to diagnose your mole over the phone or telling you to, I don't know, perform surgery on yourself.
Not at all. This is about infrastructure. It's about a system designed to save the human connection by, and this is the irony, removing humans from the phone lines.
It sounds like a total contradiction. But let's start with the problem. Why is the front desk breaking? I mean, I've seen medical receptionists. They look stressed, sure, but is it a crisis? Can't they just, work faster?
Stressed is a massive understatement. If you look at the job description that's outlined in the source, it's basically a setup for failure.
How so?
Think about the cognitive load. A medical receptionist has to be incredibly accurate because one typo in an insurance ID means the claim's denied, nobody gets paid. They have to be empathetic because the person calling might be in pain or terrified. And on top of all that, they have to be fast.
And they have to do all of that while the phone is ringing off the hook and I'm standing at the counter tapping my foot staring at them.
Precisely. The source calls it the front desk reality. They're juggling check-ins, they're ringing phones, schedule changes, walk-ins, all at the same time. It's a multitasking nightmare.
The text mentions repetitive intake as being a killer. Which, yeah. If I had to ask, what is your date of birth 400 times a day, my brain would absolutely melt.
It's not just boring, it's dangerous. This is where what they call the ripple effect comes in. When that front desk is overwhelmed, it's not just that you wait longer on hold.
Okay.
The data shows that clinical care, the actual medical care, suffers.
Hold on, connect those dots for me. How does a bad phone call lead to bad health care?
It's all about the flow of information. So when the staff is rushing because 5 phone lines are blinking, appointments get double booked.
No, that's happened to me.
Or they get missed entirely. Or the intake data is just typed in wrong. So now the nurse has to spend 15 minutes fixing your chart instead of, treating you.
So it's a domino effect.
It's a vicious cycle. The source argues this burnout leads to turnover, which means you get inexperienced staff, which means you get even more errors.
And the ultimate casualty is trust.
That is a key insight from this document. If a patient can't get through, or if the process is just a complete nightmare, you subconsciously lose faith. You start to doubt their ability to handle your surgery or your diagnosis.
That makes so much sense. You just assume if the front office is a mess, the back office is probably a mess too.
Exactly.
So, okay, let me play devil's advocate.
Yeah.
The first reaction from any business owner would be, just hire more people. If the phones are crazy, put more bodies in seats. Why isn't that the fix?
Two big reasons. First, it's just economics. You
Yeah.
can't staff for the peak 100% of the time. You have that Monday morning chaos where you need 10 people, but then Wednesday afternoon you might only need 2.
You'd just be burning money.
Right, paying people to sit around. But the second, maybe bigger reason is the after-hours problem.
Right. People get sick at 2 in the morning. In fact, my kids only get sick at 2 in the morning.
And you can't have a full administrative staff sitting there all night just in case. So the throw more humans at it strategy, it just has a hard ceiling. It doesn't scale.
Which is when we tried technology. And now we have to talk about the villain of this story,
The IVR.
the interactive voice response. Press 1 for appointments. Press 2 for billing. I hate these systems with a burning passion.
We all do.
Why did we inflict this on ourselves?
It was an attempt at efficiency. I mean, on paper, it makes sense, right? Sort the calls into neat little buckets so they go to the right person.
Sure.
But the source points out a fundamental psychological flaw. It says, patients don't think in menus, they think in needs.
Think in needs. Unpack that for me.
Okay, so imagine you have this sharp pain in your side, you're a little dizzy, you call the doctor, the menu says, press 1 for appointments, press 2 for nursing, press 3 for triage. You stop. Is this an appointment? Do I need a nurse? Is it triage? You're already anxious, so your cognitive function is lower.
And the menu is forcing me to categorize my own medical crisis into one of its little database fields.
Exactly. And when your nuanced, specific worry doesn't map neatly onto their generic button, your frustration just spikes. You feel unheard from the very first second.
And that is when I start mashing 0 and yelling representative into the phone.
Which completely defeats the purpose of the system. The source says you can't just make smarter menus. The menu format itself is the problem. It forces the human to speak computer.
Instead of the computer learning to speak human.
Precisely.
So this brings us to the proposed solution, the AI medical receptionist. And we need to be really specific here because AI is a buzzword that is, let's be honest, scaring half the population.
It is.
What exactly is this? Is it just a chatbot that reads a script?
The source defines it pretty well. It's a voice AI agent. It's designed specifically to handle those high-volume, repetitive interactions. But, and this is the key, it combines 2 things. Generative AI, so it can understand natural language.
So it can understand me when I ramble.
Yes, and strict rules-based logic. So
Yeah.
it has to follow the clinic's rules.
Okay, and it is not a diagnostic tool. It is not making medical decisions.
Absolutely not.
So if I call and I say I have chest pains, it's not going to tell me to take an aspirin and call back in the morning.
You know. And this is probably the most critical feature the source highlights. It's called the step aside.
The step aside.
Yeah.
How does that work? My biggest fear is getting stuck in a loop with a robot that doesn't understand the word emergency.
This AI is programmed with what they call conservative design. It knows its limits. It analyzes sentiment, keywords. If a conversation gets too complex, or if you sound distressed, or if your request is at all ambiguous,
It knows it's out of its depth.
it knows it's out of its depth. It stops trying to solve the problem, and it immediately routes the call to a human.
So it's basically a filter.
It's a smart triage system. It handles that 80% of calls that are, I need to reschedule my physical for next Tuesday, or are you guys open on Martin Luther King Day?
Right.
By automating all of that, it clears the line so the human staff is actually free for the person who's really having a crisis.
I like that framing. It's not replacing the human, it's clearing the clutter so the human can finally do their actual job.
Exactly. Because right now, the human is too busy rescheduling Tuesday appointments to help the crisis caller.
The AI does what humans shouldn't have to do.
The robotic repetition, yeah. So humans can do what only they can do. Empathy and complex problem solving.
Okay, let's get into the gears of this, the mechanics. Because I've worked in offices. Scheduling is not just pick a time. It's Tetris. It's chaos.
Scheduling chaos is the exact term the text uses. Just think about the variables. A physical is 30 minutes, a sick visit is 15, a procedure might be 45.
And Dr. Smith doesn't work Fridays, and Dr. Jones won't see 2 new patients back to back because he gets behind.
Right. And the patient on the phone has no idea about any of that. They just want 4 p.m.
Mm-hmm.
Now imagine a human receptionist trying to calculate all those rules while a patient's on hold and another phone is ringing. That's where the errors creep in. The AI, though, it loves rules.
It's built for that.
It processes those constraints instantly. It checks the provider's preferences, the appointment duration, the open slots, all in milliseconds.
And it probably doesn't sigh really loudly when I ask to check a different date.
That is a huge factor. Infinite patience. It doesn't rush you. I think we've all done that, right? Accepted the first appointment time offered just to get off the phone because you can hear how stressed the scheduler is.
Oh, 100%. I have booked times I knew I couldn't make just to end the interaction.
The AI gets rid of that social pressure.
Yeah.
You can take 5 minutes to find the right slot, which the data shows actually results in fewer no-shows.
Because people book times that actually work for them.
Yep.
What about intake? That's the other huge time suck. Spell your last name. What's your insurance ID?
The text highlights intake efficiency and a concept called data minimalism.
Data minimalism sounds like a tech buzzword. What does it actually mean?
It means the system is designed to capture only what is strictly necessary, but to capture it perfectly. Have you ever had a claim denied because the receptionist typed an S instead of a 5 on your insurance card?
I have. It took 3 months to fix. It was a total nightmare.
That is the problem. Human transcription error. Voice AI doesn't make those kinds of mistakes. It captures the alphanumeric data, it verifies it, and it injects it directly into the electronic health record, the EHR.
So it cleans up the mess before it even hits the database.
Exactly. No sticky notes, no trying to decipher bad handwriting. The data is structured before a human ever sees it.
I want to pivot to the part of this that actually excites me the most as a patient, the after-hours revolution. Because the current standard is just, it's insulting.
It really is. You call at 5:01 p.m. and you get that recording, "Our office is now closed."
Which basically says your health problem is on our schedule, not yours.
Correct. The AI changes this to an asynchronous model. It answers 24/7. It can capture your appointment request at midnight. It can take a detailed message. But, and this is crucial, if you describe symptoms that trigger an urgent tag, it can escalate that to the on-call physician immediately.
So it's not just a fancy answering machine. It has actual logic.
It has logic. It's the difference between a gatekeeper, which is what the old system was, and a helper. It makes sure you feel heard no matter what time it is.
The source has this great tail of the tape comparison chart. Let's just run through the stats because the contrast is stark.
Sure.
Okay. Availability. Traditional is business hours. AI is 24/7. That's the easy one. Response time.
Traditional, hold queues, long wait times. AI is instant, zero hold time.
Data entry. Traditional is manual and, as we said, error-prone. AI is automated and integrated.
Which means safer care and, frankly, faster billing.
And escalation. This is the big one. Traditional relies on a human making a judgment call, if they even answer the phone.
And the AI relies on consistent preset protocols. It never forgets to page the doctor if the right keywords are there. It takes the fatigue factor out of the safety equation.
Okay, but we have to address the elephant in the room. We're talking about health data, voice recordings. I'm thinking about privacy. I'm thinking, highball. Is this safe?
That is the make or break question. And the source devotes a whole section to compliance and responsibility. It makes a really smart point. HIPAA isn't just a checklist. It's about behavior.
How does a piece of software have behavior?
It's about how the data is handled, how it's collected, stored, accessed. The source describes the AI's behavior as being conservative by design.
We touched on that. It means it plays it safe.
Extremely safe. It avoids diagnosis. It avoids giving medical advice. If there is any ambiguity, if it's only 90% sure what you said, it doesn't guess. It fails over to a human.
That's interesting. We tend to trust humans more, but humans guess all the time.
Exactly. A tired receptionist might guess what you meant, or how to spell a drug name. The machine is programmed not to guess. It logs and audits every single interaction.
So there's a perfect digital paper trail.
From a liability standpoint, the source argues it's actually safer than the old model.
So paradoxically, the robot might be more trustworthy with the rules than the person, because the robot doesn't get tired or distracted.
In terms of strict adherence to protocol?
Yes.
Absolutely.
Okay, let's bring it all home. The human impact. Because the fear, my fear, is that AI just makes the world colder, more robotic.
But the argument here is the complete opposite. It's what they call the front desk paradox. By adding the machine, you make the experience more human.
Because the humans aren't burnt out.
Exactly. Think about the staff. If you take away those 400 repetitive "what time do you close" calls, the front desk is quiet. The receptionist isn't frantic. When a patient walks in, they can actually look them in the eye. They can smile. They can listen.
And as a patient, if I've been on hold for 20 minutes, I'm already angry by the time I get through. I'm starting the whole conversation on the defensive.
If the AI handles the logistics instantly, you're calm. The staff is calm. The quality of that human interaction goes way up.
There's a great line from Cabot Technology Solutions in the source.
Oh, I know the one you mean.
Technology in healthcare should never get in the way of care. It should quietly make space for it.
Quietly make space. That's the whole philosophy. It's not about the AI being the star of the show.
No, it's about the AI being the roadie that sets up the stage so the doctor can actually perform.
That's a perfect analogy.
So we started with this broken front door, the frustration, the hold music. And what we've seen is that this isn't just an annoyance, it is a genuine barrier to care.
A barrier that completely erodes trust.
And the solution isn't just hire more people or build a better menu. It's about using voice AI to handle the volume and chaos.
So the humans can focus on, well, being human.
It's just support that absorbs pressure.
That's the takeaway.
It's fascinating stuff. It really changes how I'm going to look at my phone the next time I have to call a doctor.
Hopefully you won't be looking at it for 20 minutes while you're on hold.
Fingers crossed. Before we sign off, I know you always have a final thought for us. What should we be chewing on as we leave this deep dive?
I want you to think about the hidden patients. We talk a lot about access to care, but consider this. If trust is lost on that very first phone call, if that front door is just too heavy to open, how many people just hung up? How many people decided, it's too hard, I won't bother, and then they didn't get the diagnosis they needed until it was too late?
That is a chilling thought. We count the patients we treat. We never count the ones who couldn't even get through the phone line.
That's the invisible crisis.
Well, on that heavy but very important note, thank you for listening to this deep dive. We'll see you next time.
Take care.